Hi, I am Dr. Felice Gersh. Thank you so much for joining me here to talk about fasting for women with PCOS. Now, I know all of you, like me, love to eat, but we as humans were not designed to eat incessantly. And it turns out that when you harness the body's innate mechanisms that are triggered by various types of fasting, women with PCOS can see seriously major improvements in their health. What fasting means, of course, by definition, it means not eating, but it could also mean what happens when the nutrient sensors in the brain don't recognize that you're eating or that you are not eating. And it also means that certain physiologic uh, adaptations in the body occur in the absence of food. All of these are fasting, and women with PCOS can use the body's innate mechanisms that are triggered by lack of food in various ways to basically heal their bodies. Well, there are different types of fasting. Let's talk about how each one can benefit women with PCOS. One type of fasting is called time restricted eating. Now, what that's referring to is not eating for various times during the 24-hour day, recognizing that we humans, and actually all life forms on Earth, are circadian. In other words, we're basically genetically programmed to survive according to the 24-hour rotation of Earth on its axis. If we now work with our body's genetic programming to eat according to the way we're really programmed to eat, then we can do much better. Now, women with PCOS have a fundamental problem. They basically have circadian rhythm dysfunction. It's kind of like living a life of jet lag. You could be living where I am in California, but yet half of your organs in your body think you're in Des Moines, Iowa, or the other portion think that you're in someplace in Michigan, or some think you're in maybe Tokyo. So the bottom line is your organs are not working synchronously in the same time zone. That's a metabolic, chaotic situation for the body. Well, if you eat to the beat, that's what I call it, where you eat at set times during the day and you focus on trying to get most of your food into the earlier part of the day when our bodies are most insulin sensitive and our intestinal tract is most functional, that is the best. So there was one study out of Israel where they took women with PCOS and had them eat two-thirds of all their calories for the day for breakfast and one-third for a late lunch slash early dinner to be finished by around 3:30 in the afternoon. Now, this is a study. I don't really expect a lot of you are going to do such a thing, but listen to the results. In just 1 month, the levels of testosterone in the blood and insulin dropped by about or more than 50%. That's phenomenal. No pharmaceuticals were used. This was strictly time restricted eating. So, once again, they ate two-thirds of their food for the day for breakfast. Breakfast would be a large meal within 2 hours of awakening. And don't think of breakfast as specific foods. Think of it as a morning meal. So all foods are welcome for this so-called breakfast. Think of it as a giant brunch. Well, we know if you've ever been to a nice restaurant for brunch, they have food of every kind. There's like no difference between breakfast, lunch, and dinner when you go to a brunch buffet. So think of it as every day, it's a great brunch type of a meal. And then one-third of the food was for this late sort of a lunch, and there's no snacks in between or afterwards. Now, you hydrate like crazy because that's really good. There's a lot of data on green tea that stimulates energy burning, and also many other teas are anti-inflammatory like ginger. So all the herbal teas that you like. And remember, spearmint helps to actually lower testosterone somewhat. And then you know what you do? You go to bed when it's night and you stop eating. Try to have a big breakfast, maybe a very small lunch, and then, a moderate early dinner. Try to always fast, especially when you're PCOS. for 13 hours from dinner to breakfast. If you want to extend it, that's fine, but the return on investment is somewhat limited. But if you want to extend it, it's not by pushing out breakfast, it's by pulling up and eating an earlier dinner. So that is time restricted eating. Oh, in addition, this is also very interesting. In that study, the 17 hydroxyprogesterone also dropped very significantly, about 40%. Now, that is a great sign. When that dropped, you'll probably be making less DHEAS. That's the adrenal androgen. So, this could be a way to help reduce that type of PCOS where you have excessive androgens from the adrenal gland. So, time restricted eating, a must for all women with PCOS. Now, what about what people call intermittent fasting for women with PCOS? That's great too. So, intermittent fasting is something that is talking about 1 or 2 days. So, that would be that you have nothing to eat for 1 or 2 days of the week. Some people will go really overboard. If you can do this, it's okay. I don't know how you can sustain it, but that's where you would fast every other day. And on the other days when you're not fasting, you would eat a healthy, time restricted diet where maybe you would have a nice big breakfast, like I said, a small lunch, and then a moderate dinner. Or you could do a good sized breakfast, a good sized lunch, and then a small dinner. And try to keep dinner relatively light and early if you can. But on the days when you're fasting, you would have nothing but water or herbal tea. Or you could do what's called a modified fast, where you can have up to 25% of your normal caloric intake. So you could eat like, well, literally 1/4 of how much food you would normally eat. And don't eat it late at night, okay? Because that would not be proper time restricted eating. That's a modified fast. A lot of people try, and some succeed, doing the 5-2. That's where you do water fasting or herbal tea fasting for 2 out of 7 days a week. 5 days you eat healthy normally with time restricted eating. And you could also modify that with a modified fast where you eat up to 25% of your normal food intake for the day on those 2 days of the week when you do this fasting. Now, what happens when you do that? Well, some wonderful things happen. You can lower inflammation in the body, and that is a huge problem in women with PCOS. They have a lot of this smoldering low level inflammation that drives many of the problems that women with PCOS face. In addition, it can really help with weight loss, and just losing weight will help women with PCOS to have less insulin resistance because you will lose some of that really bad visceral inflammatory fat. And when you lose that, you actually feel more like exercising, you have a better mood, you'll sleep better, lower your risk of sleep apnea. So, all kinds of good things can come. Now, there's another type of fasting that we call periodic fasting. That would be for at least 3 days, and not just any 3 days, 3 consecutive days that you have nothing but water or some herbal teas, or you could do it for 4 days, or you could do 5 days of what's called the fasting mimicking diet. That was based on the research that came out of the Longevity Institute at USC under the directorship of Professor Walter Longo, who I know quite well, and I have worked with him. And in fact, the offshoot of that research created a company, a venture capital funded and USC university funded company called El Nutra that makes a fasting mimicking diet. And in full disclosure, I am on their medical advisory board because I was involved in the very early research involving the clinical application of the fasting mimicking diet, which they named Prolon for promoting longevity. Now, this is a diet where you eat food, but they specially formulate it so it flies under the radar of the nutrient sensors in the hypothalamus of the brain. So I call it stealth food. You eat food, but your body doesn't see it. Your body thinks you're fasting. So you do this fasting mimicking diet, which allows what you might call success, right? Because there's no point in my recommending something that's really good for you if you're not going to do it, or you do it once and then you say, I'm never doing that again. That's crazy. I can't live like that. That's why a fasting mimicking diet was developed. It was one of those things out of necessity. They had to find a way to get their study subjects to cooperate and actually do it. Necessity is the mother of invention, and they came up with this, I think, brilliant fasting mimicking diet, which is now available as Prolon. You eat 3 meals a day, and they're light. You get like a nut bar for breakfast, soups for dinner and lunch, and then little extras that vary depending on the day of the week. And you get teas and like an energy drink. So all of that flies under the radar of your nutrient sensors. You get the full benefit as if you fasted with water for 4 days, but you get the pleasure and also the pragmatic success of actually eating for 5 days, which, although it's not a ton of food, it's a huge difference between eating nothing because you actually get to sit down and have 3 meals a day. And before you know it, 5 days are up. How often has the week flown by? It starts off with Monday, the next thing you know, Friday's already here, and then it's Saturday, and then you're done. And I've done it many times myself, so I can tell you it is highly doable. Now, what benefits would a woman with PCOS get from this? Well, in reality, there are no published studies on women with PCOS and doing much of anything, let alone fasting mimicking diets or periodic fasting. Prolonged fasting, by the way, would be more than a week, and we don't recommend that. That is when it lowers your metabolic set point, and then you lose weight, but you lose lean body mass along with losing visceral fat. And that is no good for you because after that happens, if you start to refeed, you start eating more, and then you gain it all back, and then it's harder to keep it off because your body actually becomes less efficient at using food. You have to eat less to maintain the weight that you now have achieved. And nobody is able to sustain that. So basically, you regain the weight, and that happens in 99% of such weight loss situations. So don't do it. We know it fails. When you do periodic fasting, which is anywhere from 3 to 5 up to 7, but I rarely would ever go past 5 with any of these things, then you get a bunch of different benefits. Although, like I said, we have general information, but we don't have specific on women with PCOS. So now I would be talking about a combination of research on non PCOS people and also my own practice observations in my own patient population. And what happens is there is substantial sustained weight loss. We do body compositions, and this was shown in other people on the fasting mimicking diet that the weight loss is visceral fat, almost all fat, and not lean body mass, also known as muscle. The last thing anybody wants to lose is their muscle when they lose weight, losing fat and visceral fat and fat in the liver, what we call non alcoholic fatty liver. That is what we lose when we do this type of fasting. So it's wonderful. Now, in general, with fasting, there have been studies showing that it helps to heal leaky gut. It helps to reboot the gut microbiome, get more diversity. And in animals, there's a lot of really interesting data as well for many other benefits. And hopefully, we'll have some data, hardcore data on women with PCOS. But just with what we do know in general, is that it's really wonderful for metabolic health, the creation, distribution, utilization, and storage of energy. That's what metabolism is. So when we do these different forms of fasting, particularly the fasting that is 3, 4, or 5 days, or the fasting mimicking diet, you improve your metabolic health. What a wonderful group of tools for women with PCOS to utilize. And for women who really need to lose substantial amounts of weight, you can combine all of them. Time restricted eating, the 5-2 or the intermittent fasting, and also the periodic fasting with the 3, 4, or 5 days of water fasting with herbal teas or the fasting mimicking diet Prolon. And what you would do is if you did longer fast, a 3, 4, 5 periodic fast, the next week you would eat healthy, normal, time restricted eating. And then the next 2 weeks, you could do the 5-2, where 2 days a week you did either the modified fast or a total water or herbal tea fast for 2 out of the 7 days of the week, and then back to doing the periodic fasting with the water fast or the prolon. And you can keep going until you reach your goal. And that is why every woman with PCOS should speak to her healthcare provider to see if she is, in fact, a good candidate. And the vast majority of women with PCOS are candidates. By the way, even women with PCOS who don't actually need to lose weight per se, but virtually all women with PCOS need to lose visceral fat and they need to lower inflammation, and they also may have non-alcoholic fatty liver disease, even if they're thin, and they need a good gut reboot and help leaky gut. Unless you're really thin, like a BMI of well under 19 or even under 18, that's really, really super thin, you will not be too thin, even if you're a lean PCOS, to do these different forms of fasting. And virtually everyone, unless you're very ill, very sick, recovering from surgery or some other serious thing, can definitely access time restricted eating. But please, I am not talking to anyone in particular here. I'm talking about a general kind of recommendation. So I really want you to talk to your doctor, your healthcare provider, to make sure that you are personally a good candidate for any of these forms of fasting. And then if you are, you should do it because honestly, the results can be stellar. Thank you for joining me. I hope to see you again soon. Have a wonderful day.